Hi, my name is Lori Show, and I'm a licensed mental health counselor at Capstone Behavioral Healthcare in Newton and Grinnell, Iowa. This is the beginning of the mental health diagnosis web series that we will be presenting on. There will be 4 parts to this web series, all presented by different mental health professionals at Capstone. This first part that I will be presenting on will go over the diagnostic and statistical manual of mental disorders, information on how a diagnosis is made, signs and symptoms that support a diagnosis, and I will identify the most common psychological disorders that will be presented. The 4 parts will include, of course, part 1, I just went over how diagnoses are made, the DSM-5, anxiety disorders, and trauma and stress related disorders. Part 2 will be presented by Ben, and he will review how diagnoses are made, the depressive disorders, and bipolar and related disorders. Part 3 will be presented by Dr. Gasser, and she will go over the neurodevelopmental disorders, the disruptive impulse control and conduct disorders, all the childhood most common diagnoses. And part 4 will be presented by Dr. Johnson, and she will go over more severe mental illnesses such as schizophrenia and other psychotic disorders and personality disorders. Each of these parts will be presented on their own video. All right, so if we start with a little history here on the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM. See, mine's right here on my desk. It's the most commonly used diagnostic manual in the United States. The DSM is a classification of mental disorders that identify criteria that is needed to make a diagnosis. Clinical training and schooling is needed to be able to use the DSM in determining a diagnosis. The DSM was published or is published by the American Psychiatric Association, and it is of value to all professionals in the mental health field and the medical field. The first edition of the DSM was published in 1844. Since then, there has been numerous revisions over the 60 years. Currently, we are on the 5th edition that came out in 2013. The DSM is also referred to as the Dictionary of Mental Health Disorders. The DSM contains sets of diagnostic criteria that identify symptoms, behaviors, cognitive functions, personality traits, physical signs, syndrome combinations, and durations that are all grouped into different categories, different possible diagnoses, to help assist professionals to providing guidelines for making a diagnosis, treatment planning, and to help manage decision making. In the DSM, there are 20 different categories. So when a professional is looking to diagnose somebody, they can go to what category that person matching symptoms of to see if they match criteria for a diagnosis. These are broke down right here, and we'll be covering some of these in our web series. There are going to be some that we are not covering at this time, and we are happy to do that down the road. The definition of a mental disorder, according to the DSM-5, is a health condition characterized by significant dysfunction in an individual's cognitive, emotions, or behaviors that reflect a disturbance in the psychological, biological, or developmental process underlying mental functioning. Some disorders may not be diagnosable until they have caused clinically significant distress or impairment in performance. Now, mental disorder is not usually diagnosed just because of different life stressors or deviant behavior, specific events like death and a person's sad doesn't mean that they're automatically diagnosed with depression. They have to meet criteria in the duration of time for a more formal diagnosis. Okay, so the first diagnosis set that will be presented is on anxiety disorders. In the anxiety disorders, there are 5 common diagnoses, or 5 categories for anxiety disorders. Generalized anxiety disorders, separation anxiety disorders, specific phobias, social anxiety disorder, which is actually under the phobias, and panic disorder. The one category that is not being presented on at this time is obsessive compulsive behaviors, which would be under the anxiety disorders too. Okay, so generalized anxiety disorder is one of the most common anxiety diagnoses, and that is really excessive anxiety and worry that occurs more days than not for at least 6 months. Usually a person has difficulty to control the worry. The worry and anxiety can come from everyday situations such as responsibilities at work, health and finances. Maybe they're worrying about family members, a misfortune, their children, or minor matters such as getting the chores done or what's for supper. When making a general anxiety diagnosis, a person has to be experiencing at least 3 of these 6 symptoms. And this would include restlessness, being easily fatigued, having difficulty concentrating, irritability, muscle tension, and sleep disturbance. The anxiety, worry, or physical symptoms need to cause clinically significant distress or impairment in social, occupational, or other important areas of functioning to get the diagnosis. The symptoms also cannot be attributed to by any other substances or other medical conditions. So right here is a little illustration of the person sitting and worrying and having a bunch of racing thoughts going through her head, worrying about everything. People with anxiety, you can recognize it by some of these symptoms, or even yourself. Overthinking, having a lot of racing thoughts, can't shut the mind off. They might have problems remembering things, being more forgetful, having stomach issues, headaches, trouble concentrating and finishing tasks. Actually, anxiety has a lot of similar characteristics of symptoms to the ADHD diagnosis. So a lot of times we are identifying which diagnosis a client is meeting because of the symptoms. Okay, this is a fun illustration. Separation anxiety. The little boy is pulling on his mom's shirt because he doesn't want her to leave. I feel like I kind of relate to this one, but separation anxiety disorder, also known as SAD, is a psychological condition in which an individual has excessive anxiety regarding separation from home or from people to whom the individual has a strong emotional attachment to. Okay, so to diagnose separation anxiety disorder, there needs to be at least 3 of these 8 presenting criteria for this. They need to experience recurrent excessive distress when anticipating or experiencing separation from home or from other major attachments. Be persistent and have excessive worry about losing major attachment figures or about them being harmed or injured. Persistent and excessive worry about getting lost, kidnapped, having an accident, or becoming ill that could cause separation from an attachment figure. They might refuse to go out and about, be away from home, go to school, go to work, or elsewhere due to the fear of separation. Experience persistent and excessive fear about being alone or without an attachment figure at home or in other settings. Be persistent reluctance or refuse to sleep away from home or to go to sleep without the attachment figure. Have repeated nightmares involving a theme of separation. And they could have some physical symptoms such as headache, stomach aches, nausea, or vomiting, when separated or when anticipating a separation. In children, they can also express some of these concerns. They could start having panic attacks, throwing temper tantrums, have a fear of being alone, fear of going to sleep, having nightmares as well. They could fear going to school. They could complain of stomach aches, headaches, muscle aches. They might be more concerned about their safety. They might start being extra clingy, and they might start wetting the bed. Look at that little girl. So again, just the separation anxiety disorder from the DSM. The individual is fearful or anxious about separation from attachment figures to a degree that is developmentally inappropriate. There's persistent fear or anxiety about harm coming to attachment figures and events that could lead to loss of a separation from attachment figures and reluctance to go away from attachment figures, as well as nightmares and physical symptoms of distress. Although the symptoms often develop in childhood, they can be expressed through adulthood as well. Okay, next on the anxiety disorders, we will touch briefly on the specific phobias. There are 3 different types of phobias, actually. There are more specific phobias. There's a social phobia, such as social anxiety disorder, and agoraphobia, people that are fearing they don't want to leave their house or go places. We will touch on the specific phobias and social anxiety in this presentation. A lot of people will have a specific phobia, which is identified fear or anxiety about different situations, like maybe flying or fear of heights or blood or spiders. When people are experiencing this, it can provoke immediate fear or anxiety. Usually people will avoid being in those type of situations. It could cause significant distress or impairment in social, occupational, or other areas. And when they're experiencing this, it's not usually influenced by another mental disorder or any other or a substance. Okay, now we will touch on the social anxiety disorder. Social anxiety disorder is fear or anxiety about social situations in which there could be scrutiny by other people. The individual will fear that they will act in a way or show anxiety symptoms that could be negatively evaluated. They could fear that they're going to be humiliated or embarrassed. The social situations almost always provoke fear or anxiety. Usually people will start avoiding those social situations. Usually the fear or anxiety is out of proportion to the actual threat. It needs to last at least 6 months and cause distress or impairment in social, occupational, or other important areas of functioning. So when we look at this little illustration here, this cycle, a person will have worried thoughts. They might have negative expectations and high distress and have thoughts like no one will want to talk to me. That will contribute to people avoiding or using more safety type behaviors. They might want to wear sunglasses all the time, so they avoid eye contact, or they're going to keep their hoodie up so no one can see them, or keep their earbuds in. If they're doing that, it's going to really be more prone to making negative first impressions with people, which is going to lead to negative interactions with peers. All because of these worried thoughts. All right, so social anxiety really is, afraid to go out, afraid to talk to people, make it difficult to make friends. They'd rather be home alone, scared to be in a big crowd of people, often panicking about going to a social event, nervous about meeting someone new, scared to ask somebody something. Usually they stay quiet instead of asking for something they need, like directions or maybe where's the bathroom. They might feel like everyone's watching them, and then they could regret just going out. we look up first at the top one, someone that's experiencing social anxiety. I don't know why I keep getting that tongue twisted, but a person might start being blushed and start sweating. They could experience a racing heartbeat. They might start shaking or feeling trembly. They might nauseous and dizzy. Might just want to escape. Might just start having muscle tension and pain, or they might just start having that lump in the throat or like cotton mouth. I found this illustration here, and I thought it was cute and wanted to add it in with the Easter Bunny and him saying, "I'm terribly shy and awkward. I keep hoping that if I just leave people chocolate eggs, they won't notice that I can't talk to them." Such a behavior of somebody that's socially anxious and interacting with other people. Okay, now we will go on to panic disorders. Panic disorder is a recurrent, unexpected panic attack. A panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, and during which time 4 of these next symptoms need to occur. At least 4 of these symptoms right here. So this could include palpitations, pounding heart, sweating, trembling or shaking, sensations of shortness of breath, feelings of choking, chest pain or discomfort, not feeling nauseous, feeling dizzy or lightheaded, have chills or heat sensations, numbness or tingling, start experiencing derealization or depersonalization, could have a fear of loss of control or a fear of dying. They need to be experiencing these symptoms at least 1 month, at least 1 month of one of these next 2, that they are persistently concerned or worried about having an additional panic attack and their consequences, and that the significant change in behavior is related to the attacks. So someone having a panic attack could start feeling nauseous, rapid heartbeat, chills or hot flashes, start sweating, trembling or shaking, experience numbness or tingling, getting dizzy. So that wraps up the category of anxiety disorders. Next, I will focus on the traumatic and stress-related disorders, and this will cover post-traumatic stress disorder, acute stress disorder, and adjustment disorders. Okay, so to start, post-traumatic stress disorder is when a person is exposed to actual or threatened death. They could experience serious injury or be a victim of sexual violence. The person needs to directly experience these traumatic events, witness it, learn that the trauma event occurred to a close family member or friend, or experience repeated exposure to traumatic events, like what first responders and police officers often do. Post-traumatic stress disorder, PTSD, is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terror act, war, combat, rape, or other violent personal assaults. Male and females both can experience PTSD and be diagnosed with PTSD. For men, a lot of times they could be diagnosed with PTSD if they experience sex abuse, like rape, experience combat exposure, if they're neglected or abused in childhood. Same for a female, rape, sexual molestation could cause PTSD, being physically attacked, or being threatened with a weapon. Other events known to cause PTSD symptoms. If we look at different acts of violence right here, war, terror attacks, physical assault, violence, sexual assault, seeing another person hurt, community violence, domestic violence, or it could be caused by accident type things, car accidents, falls, natural disasters, surgeries, animal attacks, if a person almost drowns, being poisoned, cancer, or other life-threatening illnesses. Could all cause PTSD. When we look at the criteria to diagnose PTSD, first they need to be exposed to the trauma, and then they need to fall in and experience these 4 different categories of symptoms. The first one, intrusion, they need to experience at least one of these 5, and that would be like recurrent or involuntary distress, memories, having trauma-related dreams, having reactions or flashbacks to the trauma, having prolonged psychological distress to traumatic reminders, have marked psychological reactions to a trauma. They could start avoid going places, seeing people, engaging in activities. They might start avoiding memories or thoughts or feelings related to the trauma. They could have a change in cognitive and mood and need to experience at least 2 of these 7, such as start having amnesia, having persistent or exaggerated negative beliefs about themselves or others or the world, experience more distorted trauma-related cognitions leading to inappropriate blame, start having a more negative emotional state, such as being more fearful, horror, anger, guilt, or shame, have a loss of interest in participating in events, feel detached or estranged from others, and really struggle to identify more positive emotions such as happiness, satisfaction, or love. People need to have at least 2 of the 6 under the hyperarousal category, and that would be the inability, irritability, and angry outbursts with really no reason why. They could start becoming more aggressive. They might start being more reckless or engage in self-destructive behaviors. They might be more hypervigilance. They might have a more exaggerated start. They might feel startled or on edge all the time. They could have problems concentrating or problems going to sleep, staying asleep, or feeling restless. A person needs to have these symptoms for at least a month, and the symptoms need to clinically affect their social, occupational, or other functioning areas of life. PTSD can occur in all people. It can occur, in any nation or culture or age. PTSD affects approximately 3.5% of U.S. adults, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime. Women are actually more likely to be diagnosed with PTSD than men. For children or adolescents, when we are looking to diagnose PTSD, well, actually, this is for everyone too. You could have more depressive symptoms like loss of appetite, difficulty concentrating. They might start isolating themselves. They might start having nightmares, being more fearful, and a lot of times people might start engaging in substance use to self-medicate or to help numb their thoughts out. Other common types of childhood trauma that could lead to PTSD would include abuse and neglect, family violence, community violence, school violence, life-threatening accidents and injuries, frightening or painful medical procedures, serious and untreated parental mental illnesses, loss of or separation from a parent or loved one, natural or man-made disasters, war or terror attacks, forced displacement or refugee status, discrimination, and extreme poverty that can all cause PTSD in kiddos. Really, the difference between diagnosing PTSD in adults and PTSD in children 6 and under is just kind of looking at the reactions in the symptoms, as they're different depending on the age. Symptoms in younger children, we look at to see if there's any bedwetting going on. Even though they're potty trained, they might be forgetful or having problems talking, or might relapse into more baby talk. They might start being unusually clingy with a parent or other adult, and sometimes they might act out what's going on during play. So playtime is actually a lot when concerns get brought up. And kids who experience significant trauma during their early years or life simply don't think the same we do. They don't perceive the world the same way we do. They don't understand things the same way we do. So a lot of times when unresolved issues don't get solved during childhood, it will continue to prolong and cause significant distress in their adult years. Okay, next I will go to acute stress disorder. Acute stress disorder occurs in reaction to a traumatic event, just like PTSD does, and the symptoms are similar. However, the symptoms occur between 3 days and 1 month after the event. People with acute stress disorder may relive the trauma, have flashbacks or nightmares, and may feel numb or detached from themselves. Those symptoms can cause major distress and cause problems in their daily life. About half of the people with acute stress disorder go on to have PTSD. An estimated 13 to 21% of survivors of car accidents develop acute stress disorder, and between 20 and 50% of survivors of assault, rape, or mass shootings will develop acute stress disorder as well. When we're looking at the difference between PTSD diagnoses, we look at the time frame. Acute stress disorder is usually diagnosed sooner, and that's between 3 and 30 days, where PTSD, when their symptoms start occurring after a month. If a person is experiencing acute stress disorder, they could start having more dissociative symptoms. If left untreated, the acute stress disorder can lead to PTSD. And acute stress disorder is easier to treat because it has really shorter term effects, whereas PTSD can be ongoing. Okay, our last diagnosis being presented today will be on adjustment disorders. Adjustment disorders are redefined as an array of stress response syndromes occurring after exposure to a distressing event. Symptoms develop when responding to a particular event or situation. Examples could include a loss, a problem in a close relationship, a job change, an unwanted move, a disappointment or a failure, just a life transition. Such as, graduation. Actually, I've seen a lot of seniors really struggle through this on adjusting into the next stage of life. These people could experience a low mood, become more sad and tearful, experience anxiety, experience insomnia, poor concentration, anger, disruptive behavior, experience more loss of self-esteem, feelings of hopelessness, feeling trapped, or feeling isolated. Adjustment disorder is usually a short-term maladaptive reactions to a psychological stress. It needs to appear within 3 months. Usually stressors can be because of loss of a loved one, change of employment, or financial situation. And the symptoms usually last at least 6 months. From then they're out, we would go over the criteria for adjustment disorder and see if there's a more identifiable formal diagnosis. When we are mental health professionals are diagnosing an adjustment disorder, we need to specify if that individual is experiencing adjustment disorder with a depressed mood, with anxiety, if they're experiencing adjustment disorder with mixed anxiety and depressed mood, with disturbance of conduct, if they're experiencing adjustment disorder with a mixed disturbance of emotions and conduct, and if a person doesn't really meet criteria for any of these concerns, then we'll put unspecified. Adjustment disorder occurs when an individual is unable to adjust to or cope with a particular stressor or major life event. And that's it. So that is the first presentation of our 4-part web series on mental health diagnoses. You can watch part 2 about depressive disorders and bipolar related disorders, part 3, neurocognitive child related disorders, and part 4, schizophrenia spectrum and other psychotic disorders and personality disorders on our YouTube channel as well. Thank you for supporting mental health, and if there's anything that any of us can do to help clarify anything, please reach out and let us know. Thank you and have a good day.